ovaries, fallopian tubes, uterus, cervix, vagina, labia minora, labia majora, vulva, clitoris, and mons pubis. If I gave you pictures of all of these things, would you know which was which? I'm S.J. Lyon, and this is the Sex Talk. Continuing with the discussion of puberty, this video will focus on the puberty of those with a uterus. Even if you're an individual possessing testes, I would encourage you to stick around. You never know what you might learn. As stated in the Puberty Basics video, individuals with a uterus often start puberty before those with testes. The start of puberty often involves an initial development in the breasts called breast budding. It's completely normal for one breast to start before the other. Even when breasts finish developing, they may be two different sizes. It's okay. Breasts can be just as diverse as the people who have them. About the same time as breast budding starts, vaginal discharges also become more apparent. Now, most individuals probably won't notice their vaginal discharges until they get much further into puberty or after they become sexually active. If you have noticed and thought to yourself, "Dear God, why?" the answer is pretty simple. Vaginal discharge occurs either due to arousal or the vagina cleaning itself. Normal vaginal discharge can be clear and thin, white or slightly yellowish and thick, or even a brown or reddish tint. The latter often occurs just before or after a menstrual period. It's also completely normal that discharge has a mild smell, not strong or unpleasant, but mild. Surprise, surprise, the vagina and vulva smell like vagina and vulva. Definitely not flowers or cookies. If you do ever find yourself concerned with the look, feel, or smell of your vaginal discharge, there's nothing wrong in talking with a doctor about it. Often the next stop on the bumpy road of puberty is body and pubic hair growth. There are some individuals who have this step occur before breast budding. You may also just notice this change more than the other two at first. Menarche, or the first period, comes along usually about 2 years after breast budding. The menstrual cycle has 3 phases: the menstrual phase, the proliferative phase, and the secretory or luteal phase. Every menstrual cycle begins on the first day of each period, starting the menstrual phase. This phase usually lasts between 2 and 8 days, so the typical length of a period. The proliferative phase follows and consists of the body preparing for the start of ovulation. When a mature ovum or egg is released from the ovaries, this marks the end of the proliferative phase and the start of the secretive or luteal phase. While ovulation is occurring, the other component of this phase is preparing the uterine lining for the ovum should it become fertile. If the egg does become fertile, it is implanted in the lining of the uterus. I won't go into details of pregnancy here, but that would be what follows. However, if an egg is not fertilized, the cycle starts all over again. Now let's talk about some bogus ideas society has about you if you have a uterus. There's this idea that you're just supposed to suffer through your periods. Yes, cramping, bloating, and mood swings are all absolutely common during or around the time of your period, but that doesn't mean you have to put up with it. As with any physical pain or discomfort, there is usually a cause that can be addressed with medical interventions. There are loads of people who experience severe symptoms, yet don't seek help because they're taught that suffering is normal and acceptable. Guess what? Suffering is never acceptable. It also doesn't matter how much worse you think someone else has it. If you're suffering, please do something about it. Speaking of suffering, let's talk about bras for a second. Bras do absolutely nothing for your breast health. There's no scientific data suggesting they help prevent breast sagging over time or even help prevent breast cancer. It's really just society over-sexualizing breasts that is the reason many people feel they have to wear a bra. Whether you do or don't choose to wear a bra, let it be based on your comfort. And don't let anyone make you feel bad about your decision. I'm S.J. Lyon. This has been the Sex Talk on puberty if you have a uterus. A quick reminder that if you enjoy my content, you can follow me on Patreon, or you can follow me on my social medias for more content. That's Instagram or Twitter. All of those are linked in the description below. And until next time, stay safe, everyone.